Welcome to Frontline. Environmental health workers whose duty it is to conduct the burial of persons who die from coronavirus say it is unfair that they are not entitled to the incentives being given frontline health workers who are involved in this fight. As members of the Ghana Environmental Health Officers Association, they are also engaged in surveillance, disinfection, as well as isolation of COVID-19 patients. So leaders of the Ashanti Regional Branch say government must immediately rectify that, what they describe as an anomaly, as their members stand an even greater risk of being infected in their line of duty. Love FM's Erastus Asari Donko has more.
Meet 45-year-old father of 5, Adongo, an environmental health person. His job entails disinfecting suspected coronavirus-infested environments, preparing and burying of deceased persons who had been infected with COVID-19. Adongo has been actively involved in such activities since the first confirmed case and subsequently death of patients in the Ashanti region. He tells me the risk to his life is high as he sometimes has to reuse disposable protective equipment or virtually beg for a new one to discharge his duty. Despite his exposure to the disease, he is not counted as a frontline staff and currently doesn't benefit from government's stimulus package.
This year, me free na tade o mode mama me dia ma hyew but me wi ama woro ho na ma hye no na dia hye no me kwa yetimi woro dwa state na makwa woro mo ho na ma gyal na me so ku tade na hye ho this year mama me yer na me makora yamben my wife to no kana so meteme ko ko fa body bi o baby sa body ni tade me ko fa ri ko cemetery ko sie ni sa body ni tade na me sa ri ko fa afoforo o tade ba ko fe at least that time no me ba kasa bia boss ba kasa bia me mpese djuma no ko ni yie ma no antra yet me no me nya abotre ya den ama me ho na me follow the boss pe no isi e be si e ba beti enso coronavirus te se aban so twa sika kakra bi e de aso yasene this is kana ndru yan akodru nurse doctors ye nya bi.
Elvis also supervises burial of confirmed or suspected COVID-19 victims in Kumasi.
I could remember when we went to the Obuasi for the 4th burial. We went there and the PPEs were inadequate because the body was in a cold room. They do not have a mortuary where we have to dress up with all our PPEs coverall to go there and pick the dead body, which is in the body bag, into the casket. And right after that, all PPEs must be discarded. Then when we get to the cemetery, we have to use another PPEs, nose mask, gloves. All these things are utilities that need not be used more often. Immediately go nearer the body. After picking or doing one or two things, you have to change them. And this has been a very big challenge to us. Because
Adongo and Elvis represent many environmental health staff on local government payroll working on COVID-19 teams across the region. They say, unlike their colleague health staff, they have been excluded from government packages despite being exposed to the similar risk. The Ashanti Regional Association of Environmental Health Officers is not happy. Stella Gabriel is the regional president.
Your members of your association feel?
Well, in fact, we feel very disappointed and dejected. We have always been on the field together with other health workers. We are part of the rapid response team, the district management team. We also are in charge of disinfection. That is from the house of the infected person to even the hospital facility. And when the person dies, we take care of the burial. What can be more contagious than these activities that we carry out? Just like any other health worker, we have contact with the patient whilst alive, and when the patient passes away, we are being asked to take care of the dead body. And when it comes to enjoying a motivation or motivational package, they are trying to sideline us, which I think is very disheartening.
Head of Local Government Service, Dr. Nana Atto Arthur, says concerns of the environmental health workers have come to his attention, and he has forwarded same to government for redress.
In the current fight against the COVID-19 pandemic, environmental health officers take a frontline role, rubbing shoulders with their health practitioners on the field. When it comes to prevention, they are in people's homes. They are fumigating areas, disinfecting areas where suspected cases are. They bury the dead from COVID-19, but they are not counted as frontline workers who should benefit from Ghana's stimulus package. They are demanding their fair share of the national cake. Reporting for Joy News, Erastus Asaridonko, Kumasi.
Erastus filed that report, and this is your Frontline. Stella Gabriel is the regional president for Ghana Environmental Health Officers Association. She joins me via Zoom right now. Hi, Gabriel. Ms. Gabriel? All right. So
yes, madam.
In the reports that Erastus filed, he talks about the authorities saying that they've taken note of your concern. They're forwarding it to the regional minister so that he will address it. Have you heard anything from them so far?
Not yet, madam.
I
haven't heard anything.
Okay, yeah. I heard you. Do you work with any specific hospitals, or do you just work with the assembly?
We have environmental health officers at most of the health facilities. When you go to Komfuanochi, there is an environmental health officer there. We have an environmental health officers unit within all the health facilities. Let me put it that way.
Okay.
And we carry out a lot of activities. For instance, disposing of medical waste, doing disinfection, and a lot more, even before the outbreak of this virus.
So, when the announcement came that frontline workers were entitled to all the things that the president mentioned, who did you reach out to find out whether your people who come also in close contact with people, close contact with potentially positive patients or even their bodies were sorted out? Did you reach out to anybody?
Yes, we wrote to the head of local government service through the regional minister to remind them, because somehow we felt it was an oversight. So we were actually expecting them to respond, and but we haven't heard anything. That is why we are actually coming out now, so that they will see that we exist, and we need to also take our share of the national cake as far as the stimulus package is concerned.
Erastus's report gives us a clear idea of the things that you go through. But for you personally, how difficult would you say your work has been? How dangerous is it now that we're dealing with the pandemic?
Well, when it comes to environmental health officers, in combating this deadly virus, we have been at the forefront. At the district levels, we are actually the lead. And the issue is that most of our colleagues have to go out without PPEs. And even the team that does the burial sometimes have to go to other health facilities to beg for. And in some instances, they have to reuse.
Stella, can you hear me? Looks like I lost Stella there. Stella Gabriel there. She was speaking for the environmental health personnel. You heard her position quite clearly. They have not heard from the ministry, even though they've written to them. The regional minister, she said they've reached out to the regional minister, but they are the people who believe that they ought to be a part of those enjoying that incentives given to frontline workers. Well, that's it for today's Frontline.